and or a social security card. Just scan your card and you can get 11 healthy indicators like your weight, your height, the body temperature, heart rate, blood pressure, the body fat, WHR. And we look at right now, we're testing the body fat. And also you can test your blood glucose, UA, total cholesterol. So overall, there are 11 indicators you can get. So the lady, she's so familiar and she can operate by herself. So right now, test her body temperature. And you can see it's just very fast. Just one click, and we can get a number. So just within 2 seconds. And we also can test the blood pressure. So for the when you're testing the blood pressure, you are not allowed to speak because that will fluctuate your number. And we talk about the and also, of course, the doctors, when you go to the hospital, they will see your record, your historical record. And that's not only one number, actually, that's a trend, that's a big curve, I believe. That's very helpful. So it's also better you have something to base on to manage your blood pressure. So for her age, I believe the number we got is quite okay. And we talk about the oxygen, the degree of blood oxygen saturation. The 95% is okay level, and the lady is 99%, so the number is quite good. So we can talk about her healthy condition is very good. So normally the number is around the 98% to 100%, but for the patients with the emphysema, then the body the oxygen level will be a little bit lower. So we talk about the whole equipment is totally can be a self manageable, and we also have the staff here to help you to get all the numbers and the tests. And we actually will all record the numbers every time when they have the test here. And this is blood sampling, and you can see it's very simple and fast. So wait 15 seconds, you will very soon know the final result. And we get the number, the UA number. So this UA number, the uric acid number, is what we want to see. And another number we want to get is the WHR, waist hip rate. And we talk about the diet structure actually is changing. A lot of people, they have quite poor WHR number. So it's want to once again stress the importance of this WHR number. So we will also upload the number to the computer, and the computer will give us the number. So they will get the calculation, and that's also help us to do the overall evaluation of the health condition. So later on, we will see her whole report. So right now, you can look at the indicators we get. Overall, the number is okay, healthy. You look at the weight, height, but you look at the WHR a little bit higher. The UA is at 0.34, it's okay. But the WHR, you need to pay a little bit attention to this. So please keep it. And later on, you go to the hospital, you also can give this to your doctor. And you also can keep it as a record, and you also can do some comparison. So maybe half a year later, you can see whether the number is improving or getting worse. So this is something you base on. So this is your first time to test this house? So this is not my first time. Because this is just so close to my house. So I can see if, like today, there's not a lot of people here. So I come here to do my test. And it saves a lot of time and energy, so convenient. So I think the government really pay attention and deliver this tangible benefit to us. So you're very concerned about your health. You look at a little bit oversized. So sometimes it's caused the heart disease and also the fatty liver. So I sometimes take time to come here to take the EDG. So also can do EDG here, but right now the ECG. For ECG, I'm also will be here. Sometimes feel a higher number of a heart rate, so a heartbeat a little bit faster. But look at right now the blood pressure is okay in the healthy range. But still the number we talk about is quite high. So I have the family disease in the blood pressure. So we also give the report. This is the complex report. So you can look at the blood pressure. We said it's okay, but it's quite common to the highest level. And look at the DBP, it's okay. And we'll also do a comparison so you can see the curve. That's the previous 2 times we did here. And the curve a little bit going up is okay because it's a seasonal impact, because right now the temperature is a little bit higher. And look at this number, it's okay, so no big fluctuation. So this is a blood oxygen saturation. And also look at the whole body healthy access. We talk a little bit oversize, overweight. And we also look at the body fat is also higher than the maximum number of health. So we look at a different, like a muscle analysis. Right now she is okay. And we also had the curve right before 25. Right now it's 35. That's the body fat. A little bit going up. So it's a good thing like we give you a curve, because sometimes it's quite hard to understand all these numbers. But you look at the curve, you know it's a curve going up, going down, then it's really call our attention. And we also have the doctors at our community clinic, so the doctor will also give some suggestions. So this is a quite intact report. So believe the residents actually they also can do the early intervention based on the healthy report. So they can also take the early actions to cure the disease. So we talk about hospitals that really take time, but here, look, it's so convenient. If you have time, just come here and you know exactly your body condition. So this is very convenient. I really think, especially for my age, my like the elderly people, is so convenient and so helpful. So we talk about besides these